the more we understand the genetic predisposition to disease, the more it opens up the opportunity for us to then start to offer patients treatment options that might be different based on their genes. And that's the really exciting part, is understanding if you have a genetic predisposition to something, first, how do we prevent it? And second, if you were to develop that disease, is there a way that we can treat you differently than someone else? Genetic testing takes it to a much deeper level, to a personalized level, because it's actually looking at your DNA, all those A's and T's and G's and C's that make up you as a unique individual. It's an extremely effective tool and incredibly accurate. So if we have a patient we've identified to have a hereditary predisposition to colon cancer, they might have upwards of an 80% lifetime risk to develop that cancer. But if we implement appropriate screening, which is frequent colonoscopies in that individual, we can reduce that probability for them to develop in colon cancer to as little, as 10%, which is a huge difference for their life. Well, we have really good testing at this point for hereditary cancer syndromes and have a pretty good understanding of what that means, and guidelines that are very robust about what we should do about that information. But when we order genetic testing for our patients, we're utilizing well-vetted, CLIA-approved, medically certified laboratories. They have to be held to a very high standard. So I would expect in the next 10 to 15 years, most everyone who's coming through the Wellstar door for something is going to be having some type of genetic testing, or will have their genetic information available that their doctors are going to be able to use to treat them more effectively or try to prevent a condition more effectively, which is to our benefit as a population in general. Hopefully it'll be a tool that across the board will help people with their health, and we're pretty quickly moving in that direction. It's pretty exciting times.